7:13. Let's just go to the KUAM News Zoom room. Dr. Hoa Nguyen of the Physicians Advisory Group.
Hi, Doc.
Hi, Doug. Good morning.
Good. Good morning, guys. Morning.
Good morning.
I guess just first of all, how would you respond to that? I know you don't work for public health, but you're familiar.
I I can't. The sheet come in kind of broken, so I'm not quite sure. But if usually you have a test anywhere, if you positive, we tell you to stay home and isolate yourself until public health contact you. Um, so we recommend you not go anywhere. If you are negative, then we either text you, email you, or WhatsApp you your result. But you don't have to come in anywhere for a negative test or any test. Even if you're positive, you really need to stay home.
Right.
So,
But that's
you
on
shouldn't.
AMC side, right?
Yeah, I mean, you should not be, come in for a negative test. I'm not quite sure. And also, if you have a test done for any reason, we recommend you stay home until the test result come back. Most of the tests come back in about 1 to 2 days. You know, and I know we have a glitch there, public health, the mass testing on the 15th of August that take 2 to 3 weeks, but it's a glitch. So that should never happen again. But test should be back 1 to 2 days. So if you have a test for any reason, I tell you, stay at home until your test is back.
Doc, I know that when we talked to you last week, you had said that there was an issue with DLS and the reagent for testing, and so they weren't going to be able to run tests until, I think you said yesterday. Can you give us an update on that situation? Because we've seen like 500 tests run, and so we're just wondering. Go ahead.
You can see, the LS number coming down quite a bit. That's one of the main lab there, and they don't have their reagent. Yesterday they report like one, but the reagent come in by United yesterday. It's kind of late, but we contact United and they really step up and secure the reagent in Hawaii and flew in last night. So the LS should have the reagent either late last night or early this morning. So they have about 300 tests or so in the freezer, so they're going to catch up. So and they do pretty good job in catching up. So today, starting today, on the clinic probably can resume the testing for the close contact as positive close contact again.
Doc, can we just jump right into the sad announcement late yesterday afternoon? 3 COVID-related deaths. I'm pretty sure this came up in the Physicians Advisory Group meeting last night. Can you shed any more light, anything on these 3 COVID-related deaths?
We received that late in our meeting. We kind of expected to have some more death in this week or early next week. Until hopefully this thing pick out. Probably this week it should be pick out because we've been in quarantine now we've been in Pico 1 for about 2 weeks already. So we should see a slowdown, but like a hospitalization usually lag about a week or two behind. So hopefully if things work well, we should see a slowdown on the hospitalization either this week or early next week. All the death, I understand that those deaths, the patient have some pretty bad comorbidity. So that's what we want to kind of try our best to keep the people who have multiple comorbidity at home and not go anywhere because they are so much in the high risk area population. So. I know we still have, I think, close to 40 plus or more in the hospital. And I think there are like 3 or 4 ICU, so hopefully we won't have any more death. But it's going to be a few more before this thing is over on this second surge. So,
right.
So we keep our finger crossed. Every death is a tragedy for it's very tragic for the family. So
Are you
hopefully
sure
we
about
have.
that, Doc? Because there are people in this community who say that all these people had so many comorbidities they were going to die anyway, or oh they were elderly, or I mean there are people who explain away these deaths as a means to reopen the economy and whatnot. So how would you address that point?
I tell you, well, these people have some comorbidity, but when COVID infected your lung and you can't breathe, and it's create another stress to your body, yes, your chance to die from COVID related death is very high. So meaning if they don't have infection by COVID-19, most likely they won't be in a situation where they are. So, we a lot of us have comorbidity, but it doesn't mean that we have to add another factor in there to increase your risk of dying. So, people have to respect other people and not say, oh, they're gonna die anyway. No, that's a really bad way to look at things when people are dying. So, you know, um, I would tell you those people don't think that way. You know, like I say, I mean, yes, people can die from other comorbidity, but you cannot add another one and justify the hate. They're gonna die anyway. That's a really bad thing to think about.
Right.
Doc, can we move into the discussions from last night's PAG meeting and what took up the bulk of discussions? We'll start there.
The board discussion is how do we need to get out of this 2 week quarantine in the hotel. That's a long way. It's the safest way to make sure that we protect our border. It's a 14 days in the hotel, but that's a long way. And there's a lot of passengers coming in. I know that the queue factor are getting full, and the overflow to the Dusit now, which is pretty nice. I don't mind to be quarantined in Dusit, but it's still a long time for people to stay in there. So we talk about planning to testing out on day 5, day 7, so people can go home if they test negative. Um, and but the only thing that we want to add is that you know you gotta have a download like a Sarah alert, some type of apps that increase um, the monitoring of the home quarantine, because after they go home on day 7 to test negative, they really have to report the symptom. They need to report where they are. So um, apps like Sarah Alert, you have to. It's a web-based thing, and you have an automated phone call, a text, a message, or something that you have to report in like once or twice a day if you have any symptom or not. You know, and the question is, what happened? They refuse. Well, we decide they have a choice. If they refuse and they stay in a 14-day quarantine, if they download the apps, then they can go home day 7 if they test out negative. So that's something that we really talked last night. I had to be approved by the governor, to make sure, and approved by public health, and so we bring it up this Friday and let the governor and public health, discuss about it, and they approve it. Then we go forward to 7-day quarantine testing out at day 7, uh, and the new home quarantine system.
So
Wait.
we're back to
Right.
discussions about early testing out for home quarantine. 7 days. Okay, I thought we were like concerned about
yeah,
containing COVID.
Because I know we just switched that up a while ago. I remember we had you on a couple weeks ago, Doc. So what has changed where now we're talking about
Well,
let's get people out of here, test them out.
if you test out at 7 days, you would catch about 90% plus of the positive findings. So it's a pretty good odd, if you can catch 90% of them, and then the rest of 10%, that's what the apps is for. We really have to do that because you really before is that we let people that have the pre-arrival PCR go home, without any testing. If they come in with the pre-arrived PCR is negative, we send them home and we test them out day 7. But they are home quarantined the first 7 days. And one we're pretty sure one of the failure in the surge is because people are not staying home the first 7 days. So now that we quarantine everyone in the hotel for the first 7 days, you won't have people walk around in the first 7 days in the public. They are in the hotel. That's a big difference. And then we test them out at day 7, which is 100% of the people that want to go home day 7 from the hotel. They have to be testing out. Before, remember, we send them home and we trust them and come into a clinic to be tested out day number 7. That's number 1. And we trust people and stay at home the entire 7 days, which majority of them doesn't follow those quarantine rule. So this is a big difference with the last one and this one because you have a control. We control the first 7 days, so you can't go anywhere until you get tested out.
Right, but you, Doc,
That answer your question? Yeah.
we actually have been talking about this move towards digital monitoring. I think it was a couple weeks ago with Dr. Jana Manglotnya, and she talked about this digital monitoring with the Sarah program, and also I think it's either Patchwork Foundation or Pathwork Foundation, and it's all web based. And so we're here and we're actually still talking about it. So we have not done anything with implementing these digital monitoring. I mean, it just kind of sounds like the same thing where we talk a lot, but we just don't actually act on things.
Those are 2 different programs, Sabrina.
No, I get that, but we've been talking about
yeah,
it, and
yeah.
this has been brought up weeks ago, and here we are, still like talking about it.
Yeah, the Sarah Alert have been there for a long time. We have not been seriously talk about that one. The other program is that it tell you if you come in contact with someone that's positive, with 15 minutes and 6 feet. So that's a different program. But Sarah Alert, you actually have to call in or text in your symptom like twice a day. I mean, so and they have, I think, the limitation like 100,000 people. So we have plenty of volume for our island. So I don't think it's going to overwhelm the system. But that's what we recommend from the physician advisory group is that you have to download the Sarah Alert. There's no choice now. We have that apps here, and we have to download it. If you don't, then you stay in the Q factor for 14 days. So you have a choice. But I think that's something that at this time, I tell you, if this 7-day testing out is implemented in the next week or so, Supreme Chris, no, they have to use the Sarah Alert. I think that's the only way that we can make sure that the next 7 days that there's some check and balance, make sure that people comply to the home quarantine. I mean, they can go shop for food, all that kind of stuff. They just have to report the symptom in, once or twice a day.
Somebody was asking whether or not the AG has issued any sort of an opinion on the constitutionality of these monitoring programs that you're discussing.
Yeah, I mean, like I say, people can refuse, but I mean, like I say, you don't have to use it. But if you don't use it, then you stay in a quarantine factor until 14 days. I mean, that's the safest way to make sure that there's no new infection coming to the island. Like I said, I mean, you have a choice. You say either yes or no.
But there's been no requests or ask of the AG to do an opinion.
Yeah, I'm sure that if the governor agrees, she's going to ask the legal counsel to work the AG to make sure that all the dots, have been checked. So I'm pretty sure that if this thing, if she go forward this, she will ask the legal counsel before it's implemented. So I don't think that they just going to implement it blindly.
Doc, I just want to ask about so it's Wednesday. Lockdown ends
I thought it was Friday.
Friday. I'm just curious what was discussed in the meeting last night about the possible extension of the lockdown because we're not seeing lower numbers. We're seeing a lower number of tests run, but the test positivity rate is still, I mean, God, it's like over 10%. So I'm just thinking, I don't see us. We haven't flattened the curve. We've fattened the curve, right? So did you guys talk about any extension of the lockdown at all? Are we going to get like a last minute announcement again? What was your advice to the governor?
We didn't talk about the lockdown and not, but I'm pretty sure she will decide that as long as this number, is as high as this was the last 2 or 3 days, still in the 50 plus, and the hospital, especially GMH, are stretched to the max right now. I don't think we're going to get out this peak hole one until GMH admission slow down, and they have a firm grasp of the admission. And the number got to go down again in the teens, but 40, 50 is way too high. So we didn't talk about it, but I'm very sure that the government
Really? Nobody brought it up?
releases out this people one.
Doc, nobody was like, hey, the lockdown's going to end Friday.
The numbers still don't look very good, especially with the 3 deaths yesterday,
Right.
and
Yeah.
we have FEMA coming in with the
Of course.
with the help with the physician and the nursing staff. So I don't think that the lockdown will be released. No, I mean, it will slow down, we hope, but again, people still travel quite a bit, unnecessary travel in the community. So I hope that everyone need to help so we can slow this virus down, so we can get out the peak hole one. But I told the main thing, the hospital, it have to slow down.
Did you guys discuss the nosocomial infection at the Guam Memorial Hospital or the fact that more doctors and nurses are testing positive for COVID?
Yeah, I think it's up to 5 physicians now. That's a lot. I talked to the hospital a little bit. I told them they really need to have a kind of conference, a press conference to kind of explain where the contact tracing and what happened in the hospital. It had to be very, transparency to the public to make sure that I'm sure there's mistake made there. I mean, when you work with so many sick patients, you can't cover every angle. So mistake have been made. That's probably why there's infection there. And they need to identify where the error is and fix it. But that had to be kind of explained to the public, so that way they don't lose confidence of the hospital.
Well, what's your...
You only have two, GRMC and GMH, and the good decision is to keep one hospital as clean as possible, so that way all the people that admitted at the clean hospital, the chance to get an infection is low. So you have to build a public confidence of GMH, so they really have to hold a press conference to answer all the questions in the community. So that's our suggestion for them.
I'm sorry, you said 5 doctors. How many nurses?
What's the question, Sabrina?
How many nurses have tested positive for COVID-19 at the Guam Memorial Hospital?
I think they in the teen, under 20. So it's just quite a bit. So they lost quite a bit of nursing staff. And the problem is that the hospital is short of staff already. And even one of them gets sick, they create a huge problem, the shortage of nursing staff. So when the rest of them have to carry the burden, fatigue and stress will set in, and you have more room for error.
So is that what happened, Doc? Is that with this hospital infection, it was an error? Or was it because Lillian was kind of saying that it could have been a visitor? Or, I mean, is there something we were told the investigation was still ongoing?
The infection can come in from visitor, which I'm not quite sure. They have to be very strict from the visitor standpoint, because no asymptomatic carrier is out there. So if you no, still allow visitors to come into the hospital, yeah, you will increase the likelihood that they carry the infection into the hospital. And and also the healthcare, the front line. I mean, at a certain point, it's kind of hard to wear your mask, for 12 hours a day. It's very hard, guy. I mean, we wear our masks in the clinic, 8, 9 hours a day, and your mouth is dry, and you really it's really stress your body a whole lot. So if they take the mask off for any reason in the hospital setting, um, they can contract the virus. So there's a lot of things can happen there. When you eat lunch together, when you huddle together, that all those are at risk. So yeah, I mean, when you deal with the infection like the COVID-19, um, and the stress factor and the fatigue will play a big part on any type of infection, we call nosocomial infection in the
Right.
hospital. You play a big part of it. And the healthcare worker, yes, can they transmit to the patient? Yes, they
Of
can
course.
if you let your guard down.
But doc, so I mean, that being said, you're saying infected nurses, a GMH number in the teens, 5 COVID-19 positive doctors. At what point do we implement this clean hospital, dirty hospital thing? And at what point do we move non-COVID patients out of Guam Memorial Hospital?
Oh, that's something that you know. Um, um, the hospital personnel like Lydian
Mm.
and Dr. Andy Bordario, Dr. Julian Agan, they need to hold a press conference to answer all this question. Like I said, I mean, at what point we move? Yeah, they are trying to move patient to GRMC, the non-COVID patient. But again, you talk about nursing shortage, right? I mean, both hospital, unfortunately, are having a shortage of nursing staff. I mean, some you gotta understand, closing the daycare. If the nursing staff don't have babysitter at home, they can't go to work. You know, it's a lot of factors that play into this nursing shortage that we have before the second surge, and we get more shortage nursing staff because the second surge. Like, I mean, if our nursing staff don't have a babysitter, then there's no daycare opening, then they can't go to work. So but to transfer patient, the non-COVID patient from GMH to GMC require GMC to have a lot of nursing staff.
Mm.
And one of the area where we talked about last night is and I know Dr. Shave mentioned before, and is that to move OB to GRMC to kind of isolate that population away from the risk of infection. Again, to move the whole line of service to GRMC, now you really short GMH of the nursing staff because they kind of cross coverage within the OB and the non-COVID patient care. So it's until we have some relief from adding more nurse to the hospital, and they will have to do that because FEMA condition is you have to recruit more nursing staff either from off island or on island in order for FEMA to justify their personnel come in and help GMH. So GMH have to come up with a certain way that they have to um, um, increase their recruitment for the nursing staff of island come in. But when you move OB to GMC, yes, we will want to push that. Um, and I think the governor also are open for that. But again, it's all about having enough nursing staff to run it. Remember, you can have bed, you can have a lot of empty bed in the hospital, but if you have no one to run it, you stuck. Even when the skilled nursing facility, which will be open soon here, they're going to start transportation to SNF. But again, it's a challenge to staff SNF.
Right. And
So
moving the pediatrics ward and the OBGYN and the babies and all that, that's not a new issue. That also was discussed months ago.
Yeah.
Including the opening of the SNU, SNF, whatever we're calling it these days. It could be called the SIF. We've been talking about this, Doc, for a while. And I think Dr. Cabrera said months. Just like
Yes,
that. Months.
months.
And here we are,
So what's the
What is
holdup?
going to be done to address these nosocomial infections at GMH to stop and prevent anybody else from getting sick? Because for me, it's like if I just wouldn't want to go to GMH because I'm scared I'm going to catch COVID there.
Right, we were reading that. We were reading that Army Corps of Engineer report, and they were talking about a lot of infection point issues.
They really have to stamp out this thing. Like I say, I mean, in order to kind of uh, um, stop any type of discussion or talk in the public regarding the nosocomial infection in the hospital at GMH, is that GMH really have to have a press conference and air out everything so public will be in the same level they are. So, like I say, we highly encourage the hospital GMH to discuss that in
Right.
public, so that
But you
way
guys are the
all
physicians
this
advisory
question
group. You
can
guys
be
are
answered.
advising the governor. I mean, there's nothing you guys can do to advise her that, okay, this is it. We need to move all the non COVID patients out of GMH over to GRMC or whatever the plan is.
Right.
Because ultimately, like you guys have said repeatedly, she has the final decision. She can tell
Yes.
Lillian Posadas what to do. I would think.
We did, well, we first time yesterday, we actually met with her and actually bring up the the moving of the OB and Peds, possibly Peds to GIMC. Yeah, I mean, we will continue to push that issue. I think that now that I mean, stepping up to try to accept those two services is up to GMH now to work on the staff issue to try to move them. Uh, you know, it's discussed in the past, but we never have a action in the hospital. Now that we do, it takes some months, but I think that once the SNF just like was taken over by the surgeon cell, when that thing come up pretty quick, within a week, it's running already. So yeah, it's a failure of GMH on try to drag them so long, and I mean, you can't deny that. But the things that happen now just because the second surge in the hospital admission is so high. So the fire is there. So they're moving much quicker. Like I said, we will continue to push the transfer of the non-COVID patient as much as possible in GRMC. Like I say, the limitation is the shortage of staff on both hospitals. Even if we want to move, if they have no staff there, Sabrina, it's impossible to move.
So, but from what we understand, FEMA is sending staff through the Department of Defense. What happens when they get here? Or are they even here yet?
Remember the staff augmentation for GMH, and I'm going to be here probably sometime this week. But they only stay for 1 month unless prove to them that GMH more nursing staff and more physicians from off island from anywhere. So that's the burden on GMH is that hey, FEMA is here, but they're not going to be here for long because they're going to monitor your action and try to recruit more staff to the hospital. I mean, you cannot stay status quo. You got to do a lot of recruitment from off island to try to augment your staff because they won't be here for long. Let's say no more than 30 days.
Doc, people are paying more attention to what's happening.
Yeah.
people, then there are people who are really scared out there about what's happening. And, we're watching how our leaders are reacting, are responding, and they want to know, are we going to be okay? You're part of the inner circle. Are we going to be okay, Doc?
I think right now, Sabrina, Chris, I feel like with all the fire going on right now, people start to move. I think that GMH have no choice right now, and the government will make the move. I mean, at a certain point, she had the responsibility of the people and then responsibility for GMH. So I think with all this thing going on, they don't have a choice no more. GMH have to improve, again, I feel for them because with the shortage of the staff and the amount of patients that they have to encounter, um, I don't think they expect to have that many. That's the sad truth, because they don't expect to have 40 people in the hospital. And should it be planned many months ago? It should. Okay, but again, and just like Lieutenant Governor said yesterday, it's a mistake. We just say it's a mistake. I mean, you can't deny that mistake.
So no, we're not going to be okay.
We're gonna be okay, just because the fire's there. So we are um, um, in overdrive mode. I think that we don't want to be there, but we'll be okay. I feel like with FEMA there, we're gonna be very harsh on GMH to improve. So we'll be okay. I mean, like I said, the only one that I'm worried about is our frontliner. They can't afford to get more people infected. So um, like I said, when we will get on them, and I say they really need to come out and have a press conference. I don't think they have one yet, right?
Well, we're getting Lillian in about an hour, so we could have a little press conference right here.
Yeah, my recommendation to them is that Lillian there, and you should have the doc there. I mean, Dr. Jolene Agon should be there in the front. I mean, she's
I've tried, Doc. I tried to get Dr. Uggan. I tried to get Dr. Berdalio. We always get Lillian. But, I mean, I'm not saying Lillian knows. So, yeah, I mean, what we do ask. I forgot who the medical director of GMH was because we haven't ever had him on.
Who is the medical? Is it Jolene or is it Bordalio? Who's the medical director, Doc? Is it
5 points, Doc. I mean, who's the medical director?
Lillian is on. She had to have her medical director on there. One of them have to be there to help answer the question. I mean, the administrator's there, but Lillian's not a doc. And you got to get the doctor responsible on to answer the question appropriately. So, again, I know. I hope they listen to this. I hope that one of them will be on in addition to Lillian.
Thank you, Doc.
Thanks. Anything else?
You okay though, man, Doc? You seem kind of, I don't want to say defeated, but you're a little more subdued this morning. Are you all right?
Yeah, it's okay. This the thing is that this Pico 1, we were hoping is 2 weeks. And again, we really need everybody to get out of this Pico 1. So, everyone have to play their role. We still see infection in our clinic that because extended family. And if you really have this symptom of congestion, coughing, do not go to work. We still see people go to work with those things and they test positive for it. Stay home. I don't think any employer will reject you from staying home if you're sick. So please, stay home if you're sick. Don't go to work, and try to not visit your extended family for now. So let's all work together, get out of Pico 1. But Sabrina, Chris, we'll be okay. I'm telling you, we will be okay.
Oh, now you're saying we're going to be okay. Now he's saying.
because we don't have a choice.
We-
We have to work on this one, right?
Right, we don't have a choice.
Doc, so who's the medical director of GMH?
I think that's Dr. Andy Bordado. I think.
Okay.
You sounded
I
unsure.
really,
Is she still? Because I get the feeling she doesn't want to be, or else we'd see her. You know, I mean, Jesus Christ, we see Dr.
She's
Janet
busy. She's
Magnolia.
probably busy.
no,
I'm just saying.
there's a lot of there's a lot of title there, and when title keep coming up and really confused who's make the decision there. I mean, I'm serious. I don't know who make decision there.
Okay. Well,
There's so many title there. So but they'll need to come out and make it public so everyone would know.
too much high official. Got it, Doc. Thank you.
Yeah.
Thank you.
Thanks,
welcome,
Doc.
guys.
Appreciate it.
Okay.
Okay, be safe.
You got the
Bye-bye.
Zoom link. If Lillian comes on and you want to jump on and ask a question, just jump back onto the Zoom. Okay.
Yeah.
Okay.
Okay.
I will.
Okay,
Thank
Doc.
you, guys.
Be safe. Wash your hands.
Bye.
Stay home.
Okay.
I'll see you.
Okay,
There
stay
you go.
home.
Yeah, there
Okay,
you go.
bye-bye.
Just like that. Say it again, Doc, so they can hear you.
Okay, stay home, guys.
Yeah, stay home unless you're
Okay,
going to the
be
bank.
safe.
Stay home unless you're going to the bank or you're going to get groceries or you're going to go buy a car or you're going to go buy a house
You're gonna go.
or you're going to go get curbside delivery. Other than all those other things that you're allowed to do, stay home. Okay, Doc?
Yeah,
You see, it's a
okay.
confusing
Have a good day,
message.
guys.
It's crazy. Okay, right on. We'll take a short break. Dr. Hoa Nguyen of the Physicians Advisory Group, 749. We're coming back with Charles Estevez. As we said this morning, we discussed with Dr. Nguyen. Help is on the way from the feds. Uncle Sam is coming back to Guam. So we'll find out about that, the timeline, what it means for the fight against COVID-19.